Hi, I'm Dr. Paul Broun. Last night, President Barack Obama had the opportunity to air his infomercial for his Obamacare plan on ABC. Or should I say, this administration's biggest champion. There's one thing that the President and I agree on, that the status quo is unacceptable. I'll tell you today that I stand ready to work with my colleagues to give the American people a plan that addresses the healthcare financing crisis and provides an affordable and accessible solution for all Americans. While this one-sided infomercial highlighted the President's plans for a new healthcare system, it did not answer important questions or ease any anxiety that many of you have about this costly plan. Most Americans are rightfully concerned. Take the new Washington Post ABC News healthcare poll that just came out, finding that most respondents are very concerned that healthcare reform would lead to higher cost, lower quality, fewer choices, and a bigger deficit, diminished insurance coverage, and more government bureaucracy. They are absolutely correct with the Obamacare plan. I share many of your concerns. Think about the last experience you had at the DMV or Social Security office, and imagine if your doctor or hospital visit mirrored that. If the government runs healthcare as well as they manage the DMV, we'll all be dead before our numbers are called for the parallel parking test. The trillion-dollar healthcare plan pitched by President Obama last night sticks a Washington bureaucrat right between you and your doctor. I'll tell you, the doctor-patient relationship certainly doesn't need a third wheel. As a physician of 38 years, I understand the importance of the relationship between a physician and his or her patients. Unfortunately, as a congressman, I have become acquainted with many bureaucrats, and I know exactly how much red tape they will inject into your relationship with your doctor. Let me be clear. I believe that there is a healthcare financing crisis, and it must be addressed. But this Obamacare plan is not the way to go. First, we must protect what actually works in America, and that is the sacred doctor-patient relationship. We must also fight to allow people to choose the personal care that suits their individual and their family's needs. To truly fix the healthcare financing crisis in America, we need targeted reform with measurable results. My vision includes making sure that all healthcare costs incurred by individuals are tax deductible. Congress should pass legislation which extends the employer's exemption for healthcare provision to individuals in the form of a complete tax deductibility for all healthcare expenses. Medicare recipients would be allowed to deduct the same ancillary medical expenses and additionally would be allowed to deduct their Medicare supplemental insurance premiums as well. Secondly, my vision includes a massive expansion of health savings accounts. The contribution level should be increased to coincide with the maximum deductible level allowed for the current high deductible health plans and index to that limit. HSA contributions will compound year to year and would be eligible to be wrapped into the holder's estate for purposes of willing it to another beneficiary. Interest earned on HSAs would not be taxed. Companies would be encouraged to purchase catastrophic insurance, the HDHPs, for their employees as a companion for matching employee contributions or a certain percentage of employee contributions into an HSA. Thirdly, we must offer a charity tax credit for physicians who perform charity medical care. Congress needs to repeal the barriers for physicians, both practicing and retired, to volunteer at clinics. This includes not only CMS barriers, but also the massive liability burdens that doctors face for even walking into a medical facility to volunteer their services. Fourthly, we desperately need Medicare reform. This is the largest and most integral piece of any healthcare reform legislation. Medicare should be a voucher system for America's seniors, allowing them to pick their own private insurance provider, one that fits their individual needs and would apply additional monies for a Medicare savings account. This would be used to pay for doctor's visits, simple procedures, and any other expenditure that can go towards health care deductibles, as well as prescription and over-the-counter drugs, as well as any ancillary purchases. Basically, MSAs would pay for the same things as HSAs. And finally, we must also work to address liability reform, regulatory reform, and offer state and other regional healthcare exchanges. The bottom line is that you deserve more options than the costly Washington bureaucratic-run healthcare program that was presented to you last night on ABC. This administration's biggest champion. Let's have an open and honest discussion in Congress about how best to fix the healthcare financing crisis in America without sticking a bureaucrat between you and your doctor.